I'm Joe Skelton. I'm from the Oriel team at Moorfields Eye Hospital. Before I go any further, though, I just want to emphasise what a privilege it is to be here today. Joe, Sonia, the rest of your team have clearly done an amazing amount of work, and it's really great to hear some of what Ocular has been doing in this sphere. So I'm from the Oriel team at Moorfields Eye Hospital, which is working on our proposals to develop a new version of Moorfields. Now, can I just ask, how many of you are familiar with Moorfields? Sort of show of well, a lot of people then. So I recognise that this is something that's going to be really important to a lot of you in this room, both now and in the future. So we're proposing the development of a new Moorfields Eye Hospital. And this would be a relocation from the current City Road site, which many of you will be familiar with, to a new site just north of King's Cross, St Pancras. Oriel is the name of this joint initiative, and it is very much a joint initiative between Moorfields and the UCL Institute of Ophthalmology, as well as the Moorfields Eye Charity. The reason for it being such a joint initiative is that we're very keen to have research, education, and clinical care all collaborating in the new space. So between the 24th of May and the 16th of September, we will be leading a public consultation on the relocation of the services. So that's partly why I'm here today, really. I have a little stand just outside, which some of you will see as you pop out. It's really important to try and gain a range of views from our key stakeholders, whether that's patients, carers, people who've had experience of Moorfields in the past, to try and see what your views are and whether you're supportive of the idea of the proposal for the relocation. So far, our patients have sort of, as Joe just mentioned, been broadly supportive of the move. They've spoken about some of the difficulties and the challenges that they've faced going to Moorfields. Our recurrent theme has been around the space, phrases like rabbit warren spring to mind. Sometimes the waiting rooms can be uncomfortable. And, you know, although Moorfields has a reputation for delivering excellent clinical care, the facility isn't always there to build on this and to develop it further into the future. So the aim is to create the world centre for the prevention, diagnosis and treatment of eye disease by bringing together excellent eye care, groundbreaking research, and the world's best education in ophthalmology. So if the move were to be approved by January 2020, then that would mean that construction could begin in 2022 and the new centre could be open by 2025-26. So yeah, why are we proposing the move? Because in spite of the age of the building, Moorfields is providing excellent clinical care, but the ageing facilities are hindering rather than supporting new growth and development. And eye disease is increasing as people are living longer. According to the Royal National Institute for Blind People, sight loss affects around 1 in 5 people over 75, 1 in 2 people over 90. So our researchers are already working on breakthrough treatments, for instance on macular degeneration, the most common cause of sight loss. But we really want to expand this and work on other eye disease as well. And to provide that sort of world-class service into the future, there's simply not enough space to see more patients and to offer new treatments. Our facilities aren't ideally designed to manage the flow of patients who often need to see different professionals and departments during their appointment. And not all areas are step-free. So I think I'll leave it there, really, and try and get a bit of feedback from the room in terms of whether you're broadly supportive of the move. And perhaps I could answer some questions if anybody wants to know more about why Moorfields is proposing this, how we work with the Institute, or anything else along those lines.
You know, well, obviously we've met. Lovely Heather Burt was able to accompany me to Moorfields to meet the team there, and yeah, there's more literature outside where you'll see what the actual plans are. But you know, I think the general feeling is that it should be a good idea. Does anyone have any concerns over the move at all, or quite happy with the services that?
Just curious, really, on practicalities in view of the funding situation in the public sector generally. Mm-hmm. How will it be funded? I mean, will you sell the existing building? Well, and how certain is it that it can happen? We've seen what's happened at Liverpool, so there are concerns when anything new is built in the health sector.
Very good question, and obviously one that we have thought about a lot. In terms of funding, we will be allocated some money from central government. So we've already sort of put forward an outline business case to NHS England, Department of Health and the Treasury to bid for that money. The money will also partly come from the sale of the City Road site, but that wouldn't be until after the new hospital was out of running that we stopped any services at the City Road site. And there will also be money that Moorfields has been building up itself through its current activities. And we also are very fortunate in that we have the support of two fantastic charities at Moorfields, and through their philanthropic efforts, we are looking to secure some money from the charitable sector as well. That said, though, you asked how certain it is that it would go ahead. This is in the proposal stage, and it is a key part of the business case that we speak to people who have been treated by Moorfields or who have a family or friends treated by Moorfields to try to get that approval from the national bodies. So at this stage, it's not definite that it will go ahead, but within Moorfields, we are definitely working very hard to try and get that case going.
Yeah. And I understand, did you mention that it was going to be a phased approach, so it wouldn't be on one particular day the whole hospital moves over to the new building?
Yeah, I mean, these things don't happen overnight. Yeah. There's discussions around whether we would keep our A&E services open for a little bit longer as we move from the City Road site to the new site north of St Pancras. Also, it's important to remember that obviously Moorfields is part of a network rather than being one organisation based on City Road. And we have Moorfields North, Moorfields South, and various other sites. So they would, under current plans, continue to operate during Project Oriel. Yeah.
So, okay. So I think there's some questions through here. You've got, on the website, people can post questions, can't they? And comments can be made. So if you think of something, you know, what the light in the ticket system, that type of stuff, then please do grab Joseph and get those noted down. I think we've got a question at the back there.
Thank you. A few years ago in the news, there was an indication that the government was going to spend more on proton therapy. Is the new build at Moorfields going to include proton therapy, like the Clatterbridge site, for instance?
That's not something that I'm certain on off the top of my head, in that we're still in the sort of consultation phase of whether to have the new build at all. Obviously, we are looking at new advanced therapies, and Moorfields prides itself as being one of the world leaders in ophthalmology. I think particularly given this drive for collaboration with the university, then that is something that would be on the table and would be considered. But it's not something that I can give a concrete answer to right now. So should I take some of the questions?
I mean, I'm guessing that we've got Bertil D'Amato and Amit Arora speaking this afternoon. Okay. So it might be that some of these questions can be answered by them, but if there's any that you're happy to tackle.
So I'll start from the top. So would this include additional consultants to reduce the huge waiting times whilst in clinic? We actually consider one of the reasons for the waiting times to be the current physicality of the building, in that often doctors, nurses, and other support workers are moving from one clinic to another if they need a piece of information, if a patient has to move from one waiting room to another waiting room. Our patient pathways and patient flow aren't designed in the way that we would design them today. The current building has been there for over 120 years, as many of you will know. So I do think that would go some way to looking at patient waiting times. And as I say, this is really a drive to make Moorfields bigger and better. So although I can't commit to a certain number of consultants for different specialities, this really is designed to maximise the amount of clinical output that Moorfields can achieve.
Will there be a separate research unit? Will that be done in the new build as well?
So all the research that's currently done in the UCL Institute of Ophthalmology, which is next to Moorfields, in that it's co-located with Moorfields at the moment, but it's not integrated. So we wouldn't have a sort of separate research site. One of the reasons for the move is to ensure that current patients can benefit from research and can be treated by world-leading researchers. As you'll know, lots of ophthalmologists are patient-facing with one hat on, and then they engage in research with another hat on. So we really want to bring that together and try and offer the best care possible.
Okay.
In terms of the Bedford question, at the moment, these proposals aren't intended to change our network sites. This is very much focused on City Road and is a separate thing. But we very much value our network in that, obviously, it's part of the NHS long-term plan and part of our vision to move patient care closer to home where possible for some routine things, but obviously for very specialist things where it really requires top consultants and professors of ophthalmology, then that would tend to be in the new site.
And then a pager system. So I think this is something we spoke about when we met with myself and Heather and you guys, is, whether somebody's handed something so that you can still go and get a cup of tea, take a
Actually, it's something that's being looked at the moment.
Okay.
So this isn't something we need to wait till 2025, 26 to do. And that's part of why it was great, for instance, when I spoke to yourself and Heather. There was loads of things and loads of feedback that we got where I thought we can go and do work with our service improvements teams now. This doesn't need to be an Oriel-specific sort of thing. So that's definitely something that we're able to look into.
So, yeah.
So I really would encourage everyone to get involved. I have hard copies of the survey consultation on my stall outside. It would also be great to just gather, have a conversation with you and try and find out more about your experiences and how we can improve Moorfields, not only for Oriel, but in the interim as well.
Fantastic. Thank you very much.
Thank you very much.